The focus of our group project is reducing readmission in older adult heart failure patients. Our research team explored reasons why there are 30-day hospital readmissions among heart failure patients. Our journey began with a peacock question, proposing the investigation of the following idea. In older adults greater than 65 years of age with heart failure, will an enhanced educational program compared to standard care reduce 30-day readmission rates? The following results are from our collective 4 integrated reviews. My name is Bill, and my focus area investigated the factors associated with readmission and how individual and hospital-associated factors contribute to the readmission of heart failure patients. This integrated review found that this complex issue is not easily captured in one type of study, and that social factors play a major role in the readmission of patients. Of the 5 studies examined in this integrated review, the major factors found were socioeconomic factors, including access to health care, living conditions, along with individual problems like hypertension, dysrhythmias, ejection fraction, and other comorbidities. Additionally, length of stay within the hospital and functional status of the individual are also factors with hospital readmissions. Interestingly, there was a paradoxical finding that found with greater interaction with healthcare providers, there was an increase to readmission due to patients utilizing the healthcare system more due to having more access and more information. Since factors influencing readmission are very multidimensional, there are many reasons that a person may be readmitted to the hospital. Being readmitted to the hospital may lead to physical and financial strain for both the individual and the hospital system. Furthermore, many of the studies exploring this topic were retrospective in nature and difficult to quantify all the specific causes of readmission. The current state of science found in this review had levels of evidence ranging from level 4 to level 6. Further investigations into this topic should include the impact of socioeconomic status's influence on both patients and hospitals. This overarching issue plays a major role in many aspects of healthcare, and identifying the influences it exerts on both individuals and hospitals could help mitigate hospital readmission.
My portion of the integrative review looked at 5 articles perceiving the barriers to nurse-led heart failure education. The survey consisted of 2 Level 3 interventional studies and 3 Level 6 survey-style articles. The studies found significant data supporting the use of an education program to instruct nurses in its association to decreasing the risk of 30-day readmissions. Significant evidence was also found supporting the practice of educational programs increases nursing comfort delivering heart failure education. Particular areas for further education were found to be needed in the categories of medication, diet, and exercise. Despite finding significant results, there were still limitations in the studies. Many of the studies consisted of a pre-test, post-test design that didn't allow for proof of knowledge retention over time due to post-test occurring directly following the educational course. Also, the research focuses heavily on the comfort of the nurse, but not necessarily the knowledge. Future research would benefit to assess knowledge over a duration of time rather than directly after interventional education.
Nurses play an essential role in the successful health outcomes of all patients. My integrative review focused on the implementation of enhanced education on disease management and self-care during and after the patient's hospital stay. 3 studies focused on nurse-led education, technological advancements in education, and improved clinical pathways set forth by nurses to significantly reduce all-cause readmissions in heart failure patients. The other 2 studies focused on improving quality of life and implementing a learning and coping strategy to manage the disease. The studies showed high levels of evidence, level 2, and also lower levels of evidence, levels 4 and 6. The studies were strengthened by large interdisciplinary teams and routine follow-ups at 7, 30, and 90 days post-discharge. but were limited to small sample sizes.
The growing rates of hospital readmissions among patients with heart failure has created need for improved reduction strategies or interventions. Hospitals around the world, and specifically in the United States, have been implementing new interventions in attempts to lower readmission rates and improve their patients' health. When evaluating 5 different studies, interventions including telehealth, specialized clinics, and improved education were found to be effective. The specialized clinics were specifically developed for patients with heart failure and with the goal of reducing heart failure readmission rates post-hospitalization. To achieve this goal, they set up annual visits that included checkups by nurse practitioners and RNs and continued education with the patient. The other interventions included improved education and telehealth follow-ups that focused on improving medication regimens, diets, and preventing the worsening of symptoms. The study's level of evidence ranged from level 2, 3, and 4. The major findings that led to significant reduction in hospital readmissions among heart failure patients can be categorized into 2 themes, which were in-depth education and long-term medical follow-ups. The use of long-term follow-ups and in-depth education can help develop effective reduction interventions throughout the U.S. that will help lower the readmission rates for patients with heart failure. These interventions are surrounded by multiple limitations. The limitations included the duration of the interventions, access to the intervention, and the numerous comorbidities that most heart failure patients have.